Hello, and welcome to our American Rescue Plan Act update webinar for May 2024 for the Department of Healthcare Policy and Financing. We're glad you're watching this webinar today and look forward to providing you an update and information about some of our ARPA projects and funding and other interesting information. Next slide, please. On today's agenda, we're going to have several items that we're going to talk through. The first is we're going to provide some general ARPA updates. Then we're going to talk about some of our projects that are recently closed that we're really excited and came out with some really good information from those projects. Then we'll talk about open grant opportunities. And then finally, we'll talk about the Direct Care Workforce Dashboard demo. This is a new website that we've implemented that should help folks in the direct care workforce and provide information on wages for our direct care workers here in Colorado. If we could go to the next slide. All right, so we're going to kick it off with some general ARPA updates and just briefly by the numbers. I think the numbers that really kind of stand out are we've reached over 10,400 stakeholders through our stakeholder engagement activities, which we're going to talk a little bit about later on. We've also had over 98,000 views on our ARPA webpage. And again, just a friendly reminder, we have 61 current projects with 5 projects completed, and we've had over 1,100 grantee recipients. If we go to the next slide. And I'm going to turn it over to Emily Reddick to talk about some of our impact and budget information.
Thank you, Patrick. So we're going to talk about impact in 3 different areas. One area of notable impact so far with our ARPA HCBS projects is in the area of training. We have 10 ARPA HCBS initiatives that have developed training programs to date, and these are reaching many stakeholders by providing training in 3 notable areas. One area is to our direct care workforce. This has been primarily through Project 1.05, which offers grants for individual and provider training programs, and is also developing training curriculum in multiple areas, including cultural competency. For another area where training is being developed is with case managers and case management agencies. This is happening through several projects who have dedicated their time to various case management training efforts. And last but not least, we are also providing training directly to members and members' families. And there are several project teams providing targeted training efforts on various topics. More information about our training efforts and our training programs is available on our project website. And just as a note, the impact of these training programs, we ask pre and post surveys, and we have a high response from the survey respondents indicating that the training efforts help them. And so we're very proud of a lot of these efforts going on. Next slide. Another area where there has been a lot of impact from our ARPA HCBS projects is in stakeholder engagement. We've worked very hard to include the community as we move forward these 61 initiatives. Almost all of our projects have included stakeholder engagement at some level. As you can see, over 50 of our projects are including stakeholders in various stages of the projects, and this has happened through 258 meetings, and as Patrick mentioned before, over 10,000 attendees, which is really impressive. We've also made efforts to update, to share these updates to our projects through our monthly newsletter, which is called the ARPA Project Pulse. And if you aren't currently subscribed to that and would like to be, please reach out to us and we'll definitely get you connected. Next slide. The last thing we'll talk about as far as impact is the grants, pilots, and community funding programs, which are also having a huge impact and are a big part of our ARPA HCBS initiatives. We have provided funding to more than 1,300 community partners. Over 700 of those are individuals who have participated with Project 7.02's Member Emergency Preparedness Program that helps provide backup power supply systems to our members. There are through 26 programs, we have spent over $67 million, and that's been distributed into our community through unique and innovative efforts. Another data point that we'd like to highlight is that 88% of our grants have been issued to organizations that have one or more diversity classification. And if you'd like any more information about any of these programs, we have a website page dedicated to our grant efforts, and we'd love for you to check that out. Next slide. So another important piece is how we're doing on the spending overall. So as you can see, we have $551 million that was dedicated for these project efforts. $385 million has been spent as of the end of April, which is about 70% of the spending. And most of the spending that is left is related to our contracts, grants, and systems projects, which are our 61 initiatives. And there's 149 contracts that are underway and in process in order to accomplish that work. So lots of wonderful effort going on, and we're very excited to share with you more of the closures, but I think a few of the projects will be sharing about that next. So thank you.
Thank you so much, Emily. Yeah, that's, as you can see from Emily's presentation, we're trying to get a lot of money into the community, a lot of folks working really hard, also trying to get stakeholder engagement, stakeholder involvement, get information out to folks. So thanks for going through that. And so next up, we're going to talk about recently closed projects. Each project has a different, time frame. Some of these projects closed a little earlier than some of our other projects. And we've had a few that are recently closed. And I'm really excited about these projects, and we really want to highlight the ones that have closed recently and allow folks to talk about some of the really good work they did. So I'm going to turn it over to Cassie Keller to discuss one of her projects that was recently closed. Thanks, Cassie. I think you're on mute.
I was working on the camera. Thanks, Patrick. I appreciate that. Max, if you could do the next slide. I am here to talk about project 6.02. And really what this is making updates to our provider or our external facing website and creating a specialty search tool for providers to utilize, where they are going to be able to better understand if they are providing hands-on care to an individual with activities of daily living. They'd have a better understanding of what additional services they might be able to provide in addition to something like personal care. They could also provide respite, potentially homemaker services. So this really exciting project was able to help our providers to not only figure out if they're newly enrolling, what kind of services they should be providing or they could be providing, but also helping existing providers better understand the breadth of different services they could provide, the different populations they could serve, and really expand our provider tool. So what we have done is create this on our external facing website. We have updated this web page to help guide those providers. We sent out a memo notifying providers of these changes and how to utilize this, and community members on how that can be done. The most exciting part is we have used $0 for this. We thought we were going to need to hire a vendor to be able to do this project, but we were able to utilize internal research. We were able to utilize internal resources instead. And so that was really exciting to be able to save money and put that funding toward other projects. Like I said, the outcome of this has really been that website that because we were able to do this ourselves, we're able to update it. So anytime we make changes to the credentials for provider enrollment, we'll be able to continue keeping this specialty search tool updated. And so that's one of the steps that we have is in our annual website review. We're going to be reviewing this website to make sure that all the content is up to date. So pretty simple, but we're hoping to be very effective in expanding our provider pool. So with that, I will be handing it over to Rachel to talk about her project.
Hey everyone, my name is Rachel Newton and I am a quality policy specialist here at HCBS. I was the project lead for ARPA 8.09 waiver quality expansion. This project expanded the waiver quality surveys administered by HCBS. We partnered with an independent firm, Vital Research, to assist in the development and administration of 2 surveys, the Children's Waiver Satisfaction Survey and the Case Management Satisfaction Survey. Given the importance of case managers in delivering services to residents of the state of Colorado, we generated the Case Management Satisfaction Survey to obtain a better understanding of case managers' satisfaction with compensation, benefits, career advancement, training, and overall fulfillment in their positions. In addition, we hope this understanding would aid in recruitment and retention of case managers throughout case management redesign. With the creation of the Children's Waiver Satisfaction Survey, this was an effort to expand on the National Core Indicators Children's Family Survey, which we historically participated in. However, the survey primarily focuses on waivers providing services to children with intellectual and developmental disabilities, which in Colorado is only the Children's Extensive Services Waiver. So the new children's survey received feedback from families and members enrolled on all 4 children's waivers, which added members enrolled on the Children's with Life-Limiting Illness, the Children's Habilitation Residential Program, and the Children's Home and Community-Based Services waiver to the sample. So this survey aimed to establish insights into member experience, satisfaction with services and supports received, and additional services and supports members and their families needed. So the data will be utilized to recommend changes to the waiver programs and will serve as baseline data to track outcomes of changes in policies and programs in the future. Next slide, please. So taking a deeper dive into the Case Management Satisfaction Survey, the final survey included 34 items where case managers were asked close-ended questions about their overall engagement and satisfaction in their roles. It also included an open-ended item for additional comments. So this survey launched at the end of October 2022 and it concluded the end of November. A total of 1,040 potential case managers or case management supportive staff received a link, and then 3 reminders to complete the survey via email for a chance to participate. A total of 580 responses were received, so this exceeded our goal, and we were very excited to have so many case managers participate. Next slide, please. Some key findings from the Case Management Satisfaction Survey included nearly 80% of case managers are satisfied with their job. Case managers think that the work they do is important. They feel a sense of accomplishment and they find their job enjoyable. 73% are satisfied with their wages and benefits, yet based on the open-ended comments, we also found that compensation was noted most often as an area that is a source of dissatisfaction. Case managers also feel they enjoy a good amount of autonomy in their job, and they believe their current work environment empowers them to accomplish their work in an effective manner. However, half of case managers feel their work environment is very stressful. And then 31% of respondents had worked for their current agency for 1 to 2 years, and 67 had worked as a case manager for 3 or more years. Next slide, please. Okay, so now for an overview of the children's survey. So again, the children's survey surveyed all 4 of the waivers. The project produced 2 children's waiver survey instruments, one for members under the age of 18 and one for members 18 years and older. We asked families questions regarding like services and supports, family needs, case management, and service planning, and lots more. The survey launched in August 2023 and data collection closed in October. 5,259 families enrolled on the children's waivers received invitations to participate in the survey, and they received these invitations via email or through snail mail. 941 surveys were completed and used for analysis. So again, this exceeded our expectations by an enormous amount. So typically with the NCI children's surveys, we receive about 250 responses per survey cycle. So we were very excited so many families chose to participate in the survey and assist us with this project. Next slide, please. Some key findings from the Children's Waiver Satisfaction Survey. So generally results for satisfaction with case management was positive. 90% of respondents reported case managers were responsive to their requests. 89% were very satisfied or somewhat satisfied with their case manager. And 98% reported their case manager respects their family's choices and opinions. All survey respondents were also asked to rate their overall quality of the services and supports their family receives on their waiver program. 83% of respondents rated the quality of their services and supports as either excellent or good, and only 17% of respondents felt their services and supports were fair or poor. We do have a final report available, and you can always check out if you're interested in seeing those results on our ARPA website. Next slide, please. And that concludes for me. Thanks so much.
Thank you so much, Cassie and Rachel. And I think both of these projects are really good examples of, putting our ARPA money to use, whether it be improving an experience for members and providers or gathering information from members to figure out, what their needs are, how we can better provide services. So I think both of these projects are really good examples of that. Next, I think I'm turning it over to Max to discuss some open grant opportunities that we still have. So it's not too late. If you're interested in an ARPA grant, we've got a couple of opportunities available for you.
Great, thanks, Patrick. So I'm here today to remind everybody about this very exciting opportunity that is a part of our Member Emergency Preparedness Project, also known as Surviving in Place. We are partnering with the Center for Inclusive Design and Engineering out of the University of Colorado, Denver, for this project to distribute battery backup power supply systems to eligible Health First Colorado members. So what is a battery backup system? These are state-of-the-art devices that are able to provide hours, days of battery backup power for life-sustaining devices. So that could be such things as nebulizers, CPAP machines, oxygen concentrators, things that individuals with a disability might need in order to buy a little bit of time in the case of an emergency. We've distributed over 1,000 of these devices throughout the state. We still have funding left, and we're trying to get the word out to as many people as possible that these are available to them. In terms of the process, to be eligible, you have to be an active member, obviously, and you have to utilize some form of life-sustaining equipment that requires electricity. So wheelchairs, wound care management, chair lifts, all of these would qualify. We have a list of these qualifying devices on our website, even things like refrigerators that are used for refrigerated medication that might be necessary. These can come in extremely handy in all sorts of emergencies. It could be wildfires, as you know we have in Colorado. It could be severe wind in the southeast corner of the state. If you live in a rural area, it might be extra important to have one of these, as the power grid and the systems in rural areas can be a little bit more fickle in times of inclement weather. So please let people know about this project and have them apply. We will be wrapping up this project in the coming months as the funding continues to dwindle, but we definitely want to make sure as many people as possible are able to get access to one of these devices. So these links that are here on this slide, which you can find once it's posted to our website, go directly to the application. Our partners at the Center for Inclusive Design and Engineering are there to answer questions if you have anything, and you're always welcome to get in touch with us at HCPUF if you have questions about this as well. So with that, I'm going to turn it over to Heather Johnson, who is going to talk about some other funding opportunities that are still available.
Right. Skip to the next slide. We're winding down in our training grants. So the final HCBS provider training grant cycle closes 5 p.m. on May 31st. Awards are up to $1,000 or up to $100,000, but can really be anything under that amount. It's important to understand that this grant is reimbursement based and it supports training for the HCBS workforce that is higher level training. So it can't be trainings that they would automatically be required to do as part of an annual or onboarding process, but it can be a pretty diverse array of training in order to target higher level skills for this workforce. You can find the application and all the supplemental details on our website. I want to call attention to the due dates. The awards come out on June 15th. It might be June 14th, depending on if June 15th is Saturday. The training has to be spent by August 30th, and you could expect to start the training probably in early July. So just shy of 2 months for this. We know that's a short time span, but we wanted to make that opportunity available for folks in case there is some quick training they'd like to support their staff with. The funding can include the cost of training materials specific to the trainings, and also staff wages or incentives to attend that training. We understand that training is the burden of the provider, and that oftentimes just budgeting for that extra training has not really been something that could be focused just to due to a lot of needs. So we want to be able to support that with this grant. Some examples of higher level training can be found on our website. We've supported crucial conversations, secondary trauma. We've supported RBT training, folks going from personal care worker to CNA. So it's pretty broad. And if you have questions, feel free to ask us or get some ideas on the website. We're happy to help you explore how this would work best for you. The other training I'd like to call attention to is the individual grant. This is also for higher level training and a reimbursement-based grant. It is for the individual direct care workers themselves to apply for, or someone who is interested in joining the HCBS workforce. Grants are up to $500. It can be any amount underneath that. The grant can include cost of training materials for that training, and also travel if it is mileage or public transportation costs to attend that training. If there's not a virtual option, we'd love to be able to support you traveling to get there. The awards are a rolling basis, so you will know if you're awarded this within 15 days of application. And again, you have to have all the training done and the spending done by August 30th, 2024. Really encourage folks to look at these opportunities and see how they might work for you. And then on the next slide, we wanted to do a little dabble into our direct care workforce dashboard. So you will find the dashboard online. It's a live update. So we just provided some slides here just to show you so it doesn't distract and refresh. The dashboard has been out there for a little bit, and we will be updating it with the 2023 data shortly. You might wonder why it takes so long since it's May 2024. We gather this data once a year, and it is a relatively new process. So engaging all of the HCBS providers to understand and comply with this requirement has been a little challenging. So we keep working for other ways for folks to understand that they have to supply this information. This information comes from the base wage attestation. And so on this first page, you can see at a glance, what you're going to understand is how many workers are in the workforce and how many providers were captured with this data. So we have almost 30,000 direct care workers captured in the 2022 dashboard and 669 providers. We also further do a breakdown of providers, hourly versus per diem. That would be your daily, monthly, biweekly rate. So the majority of the workers in this workforce our hourly workers. The other thing that I wanted to call out here with the dashboard you'll see is the increase in wages from start to finish. So we track the wages when they start from that calendar year or from the captured year to when they end. So we had $1.30 an hour increase in 2022 for wages. It's not reflected here, but you'll see it on the dashboard. The per diem increase was $11.25 per day. When you check out the dashboard, you'll also see that we can further break down the starting and ending wage by primary services. So there's 17 primary services captured that the direct care workers do, and we provide a further breakdown of that. And if you go to the next slide, you'll see another breakdown of how many people are working in this space. On the actual live dashboard, if you hover over the bar, it'll give you the exact amount. From this screenshot, you can see that personal care is just shy of 10,000 workers in this workspace. So we have 9,558 workers in this. So this is by far the most utilized service available across all of the waivers. We really want the dashboard to give folks a glimpse into the workforce, how many people are working in this space, how many providers are in this space, what is the wage, where's their growth, where is the stagnation. This can be used as a recruiting tool. If you are well above that average wage, you can certainly highlight, hey, look, we're a provider who's paying above the state average. If you're not there, it kind of gives you maybe an insight on how you might be able to redirect some funds so that you can be showing that you're like, we're making the average, or we're well above the average for this service. In future iterations of this dashboard, we are going to add in some additional information that we're gathering. We'd love to be able to report more accurately the turnover rate that providers are experiencing, and hopefully being able to show some return on investment from all of our strategies for that decline in turnover rate. And additionally, we will start capturing the benefits offered within this space. So we'd like to be able to show that out year over year. Is there a growth in benefits available for our workforce? We know in addition to wages, benefits is a primary reason people don't stay in this space. So we want to be able to show how we can support benefits for the workforce, and then hopefully use that again as a recruitment tool. And so keep an eye out for future updates. We should have the 2023 base wage updated by the end of this month, and we'll put out announcements through our constant contact newsletter and through various forums so that you can see the changes from 2022 to 2023. And that is all I have. I will pass it over to Patrick for closeout.
Thank you so much, Heather. Just wanted to thank everybody for watching today and for your interest in our ARPA projects and our ARPA work. Want to thank our presenters for presenting today. As you can see, we have some very exciting initiatives that are currently going and will continue to go through the end of this year. And we've had a couple of projects close out, and we will be providing additional information as more projects close out and time goes on. If you're interested in our ARPA work or want to learn more, please visit our website at hicpuff.colorado.gov. And in the search bar, you can type in American Rescue Plan Act or ARPA, and it'll take you to our ARPA page. There's a ton of information there. And if you have a question about any of our ARPA projects, there's also a contact link where you can reach out to us and ask questions. And just wanted to thank everyone again for watching this webinar today. And we appreciate your interest in HCBS and specifically our ARPA projects. Thank you.